Welcome to Logical Ayurveda. Today we are going to discuss about a disease called Grahani. There are some things in your life that you know for sure. You don't believe it, you are not so confident about it, but you are sure, you know it for a fact. Like if you throw a ball up in the air, it will come down for sure because of the gravity. You know it for a fact. Similarly, there are certain diseases which an Ayurvedic physician know that you can cure it for sure. He know it for a fact that he can cure it. One such disease is Grahani. It makes Ayurveda physicians so confident about the logics of the science. After experience of treating so many cases, the results of this becomes pretty much obvious. One of the beautiful vyadhi we can treat like this is Grahani. It is compared in allopathy or contemporary science. It is compared to many diseases like irritable bowel syndrome, sprue, malabsorption syndrome, ulcerative colitis, even Crohn's disease. But as I said earlier, it is not important to name a disease. It is important to treat a disease on a basis of dosha and symptoms. How effectively you are going to treat a disease is much more important than naming the equivalent of the disease. So whatever name you want to keep it, but treat it properly. So this is a tweet of Mr. Sridhar Vembu, who is a CEO of famous company called Zoho. He stresses the importance of using traditional food for irritable bowel syndrome and how we got the consultation which made him practically disease free for the rest of his life and how he is comfortable. Such big persons who are internationally acclaimed are turning towards Ayurveda, are turning towards traditional foods for curing the IBS. So the Ayurvedic treatments are so efficient and competent, and the principles are laid down on a stone, and it is very easy to treat these diseases. Basically, the definition of Grahani is Grahana means absorption of the food from the intestine, absorption of the required necessary part of the food. That is Sarabhaga from the food is called from Grahana. That is the duty of the intestine, is to proper absorption of nutrients from the food. Grahani is a disease where there is no proper absorption of nutrients from the food. In fact, most of us must have come across the shloka Muhur Baddham and Muhur Dramam. Grahani is such a vyadhi where vata is in play. There will be repeated episodes of constipation or repeated episodes of diarrhea. Stools will be sometimes in solid in consistency. Stools will be sometimes liquid in consistency. Sometimes pain will be there. Sometimes pain will not be there. In ulcerative colitis, stools will be mixed with blood. In irritable bowel disease, stools will be mixed with mucus. So basically, Grahani is a vyadhi where there is no proper grahana or there is no proper absorption of the food from the intestine. As a thumb rule in Ayurveda, like any other disease, like any other treatment protocol, identifying Grahani and giving a single particular medicine does not cure Grahani. Whatever you choose, a single particular medicine does not cure a Grahani. Depending on the Vyadhi Avastha and the perfect diagnosis, the medicine has to be changed from while to while to give a perfect result to the patients, to make sure that he is completely cured and the Vyadhi does not recur back. Before learning about Kafaja Grahani, before learning about how to treat Kafaja Grahani, I will tell you about the Samanya Aushadhis that I use in any form of and every form of Grahani. These are the medicines that I use for every patient of Grahani, and only the medicines, that is Sahaushadhi, the medicine that are prescribed along with changes, but this baseline medicine does not change. So these three medicines are: one, Samanya Aushadhi for Grahani is number one Vilvadi Guliga for each and every patient, including Kafaja, Pittaja and Vataja Grahani. I'll definitely prescribe Vilvadi Guliga. Number two, Madhifala Rasayanam. In Grahani, there is a two aspects. There are two windows of Madhifala Rasayana. One, Amla Rasa. It is Hridya and it is nourishing and it provides strength to the patient and it reduces the Vata. That is number one. Grahani is basically Vata dosha, Muhur Baddham, Muhur Dramam, etc. So Madhifala Rasayana helps in reducing that, number one. Number two, Madhifala Rasayana is rich in electrolytes and it gives intensive nourishment to the patient, often taken at when Whenever old age patients used to take Madhiflorasana, they tell immediately I feel some prasada like effect, some nourishment like effect to my eyes, etc. So it has such a good electrolyte replenishing effect. So for these two reasons, I choose Madhiflorasana, and I choose Vilvadi Gulika because Vilvadi is the basic medicine for Grahani. And number 3, I choose Dadimastaka Churnam. Dadimastaka Churnam, I will not choose it for everybody, but it's an excellent Stambhaka Dravya when given along with buttermilk, and Sahapana and Anupana differs. But Dadimastaka is excellent in stopping repeated bouts of bowels. So let us talk about Kafaja Grahani. Kafaja Grahani, what does the patient come to your clinic? If the patient comes to your clinic, if a patient of irritable bowel syndrome or any disorder comes to your clinic, how do you identify him as Kafaja Grahani? There are almost few cardinal symptoms with which you can identify the Kafaja Grahani. Minor symptoms like bloating, indigestion after food, he feel like gas fills stomach, and all those minor Kafaja Ajirna symptoms will be there. But the main classical symptom, cardinal symptom that differentiates Kafaja Grahani from Pittaja and Vataja Grahani is that the patients will have repeated stools of normal to semi-solid consistency. The patient will have repeated episodes of stools of normal to semi-solid consistency. And number 2 is the most cardinal symptom. The patient will never feel satisfaction after going to the toilet. He always feel there is some left out, or there is some residual mala that is present in the stomach. So that is the important symptom of Kafaja Grahani. Number 2, stools will be mixed with mucus, stools will be mixed with froth, or stools will be mixed with saliva like watery substances. So this, number 1, the patient is having repeated stools of normal to semi-solid consistency, number 1. Number 2, the patient is having repeated episodes but no proper satisfaction of evacuation, number 2. Number 3, stools may be mixed with mucus or froth, that is number 3. Or mucogelatinous substances, something like that. So these 3 symptoms differentiate Pittaja Grahani and Vataja Grahani from the Kafaja Grahani. Now, why does Kafaja Grahani occur? It is a beautiful topic, and it has a beautiful reason. Now you go to West, you go to European Union, you see their foods, their foods will be containing a lot of maida. They will be eating more bun and bread and all stuff like that, dessert. They will be eating Sheetala Ahara like desserts, ice creams, etc. They will eat Guru Aharas, they will eat Snigdha Aharas and oil fried foods, etc. But that will not cause excessive problem to them. Why? Because the people who live in European Union live under constant state of Hemanta Rutu, extreme winter. So in winter, in Hemanta Rutu, the Agni is said to be at peak, the digestion is said to be at peak. Whatever you put inside stomach, whichever poison you put inside stomach, whichever heavy digestible food you put inside stomach, the stomach will be able to digest it because of the existing climatic conditions of the particular country. So their food does not disturb them. Whereas you go to an Indian restaurant, you order 2 parathas and a butter chicken or gopi Manchurian, and then finish it with a dessert like kulfi or an ice cream and come back. How do you expect a normal bowel evacuation the next day? The patient will obviously end up with Kafaja Grahani. So intake of excessive Guru Ahara, Snigdha Ahara, Sheetala Ahara causes this, number 1. And now people are crazy about all those keto diets, etc. Anything you can take only oil fried foods, oil fried chicken, oil fried vegetables, oil fried eggs, oil fried everything, definitely will end up in Kafaja Grahani. Those keto people have chronic irritable bowel syndrome. It is one of the most common side effects of ketogenic diet. The stomach upset is one of the major problems of ketogenic diet. So you have excess of all these foods, definitely will end up with the Kafaja Grahani. And Kafaja Grahani, minor symptoms like bloating, ajirna, etc. will be there. Major symptom is that repeated stools of normal to semi-solid consistency, improper bowel evacuation and not feeling satisfaction. Stool will be mixed with mucogelatinous substances and froth. That is the cardinal symptom of Kafaja Grahani. Coming to how you treat a Kafaja Grahani. See, one of the beautiful dravyas to treat Grahani is Kaidaryadi Kashayam or Kalashakadi Kashayam, which contains curry leaves. Karivepla is its main ingredient. Whenever we go to an Indian restaurant or people taking Indian food, they take food there is curry leaves in the food. They keep the curry leaves aside and they take the food. The curry leaves are present in Indian cuisine for a simple reason that it is an excellent pachaka dravya. When you take the curry leaves along with the food, it makes sure the food is digested properly and proper evacuation of mala is done. That is why Kaidaryadi Kashayam or Kalashakati Kashayam is one of the best used medicine in Kafajagrahani. Sir, I have improper bowel evacuation, I have bloating, I have no proper digestion, I feel tired after having food, etc. We give Kalashakati or Kaidaryadi Kashayam as the main aushadhi, whereas in Indian cuisine it is pinned along with the food. So we have to educate our children and even the bigger ones to take curry leaves properly along with the food. They are there for a reason. So Kalashakati Kashayam or Kaidaryadi Kashayam, they're the best medicine when it comes to Kafajagrahani, when it comes to digesting the undigested food and giving proper evacuation. This can be used. And I use Samanya Aushadhis like Vilvadi, Guliga and Madhifala Rasayana. That is in every Grahani I use her. When it comes to Arishta, you can use Madhukasavam. And I choose Pachanamrita Kashayam or Amrutotram Kashayam wherever they needed, and depending on the patient conditions. So you see most of these dravyas contain haritaki, and it is mentioned in classics also. Haritaki, if you give any laxatives, if you give Avipati Churna, if you give that Churna, this Churna, Trivrit Lekhi, etc., it will only cause laxation. It will only evacuate mala. But Haritaki is one of the beautiful dravyas which has a property of it goes inside stomach. It says, hey, I do not want to evacuate everything improperly. There is improperly undigested food in this, and there is nourishment that is needed for this body. So I'll make sure I separate the nourishment that is needed for this body from the food. I'll make sure I digest the food properly, and then I evacuate. I clear everything. And then I properly evacuate it. Haritaki is one such dravya with an artificial intelligence which can go inside the stomach and decide which is the improper food that is needed, which is the proper food that is needed. That is why Haritaki is called Mata. Haritaki is equivalent of Mata. Esya Mata Grahe Nasi Tasya Mata Haritaki. Because it is such an intelligent separating effect. It knows which nourishment is needed for the body, which is not needed for the body, and whatever which is not needed for the body, it makes sure it evacuates and makes the bowel clear. In fact, I use for cholesterol, I use Abhayarishtam plus Mustarishtam big time. So Mustarishtam I also use in Kafajagrahani. Why? Because Musta is an excellent Pachana Aushadhi. So I give Abhayarishtam and Mustarishtam. So that is excellent, and when the patient takes 3 months of Abhayarishtam and Mustarishtam, I have seen VLDL and triglycerides reducing to a greater extent. So this is taught to me by my Sahadevan sir. So coming to the context, in Grahani you can also use Mustarishtam, that is excellent Pachana Aushadhis, and Madhukasavam is also an excellent Madhukasava. It's content is honey. It's an excellent Pachana Aushadhi, and Takrarishtam can be also used in Kafajagrahani. It is an excellent dravya for digesting the undigested mala and evacuating the bowel, and thereby giving the satisfaction to the patient. These are the medicines I use in Kafajagrahani. So, unlike Kafajagrahani, the Pittajagrahani has exact opposite nidanas of Kafajagrahani. That is, it comes because of excessive intake of Ushna Ahara, Kattu Ahara, Amla Ahara and Lavana Ahara. What are those? As a practical example, we go to a hotel, order a tomato soup, followed by Szechuan spicy noodles, and followed by having mushroom tikka or chicken tikka as a side dish. We take excessive amla, tomato soup, excessive shara, vinegar that is present in fried rice, excessive spices, Kattu Ahara, oil fried that is heavy to digest. All these foods that definitely lead to Pittaja Grahani. So what are the basic symptoms, trivial symptoms of Pittaja Grahani are? In any Pitta we have Hrit Kantadaha, burning sensation in epigastrium. That is a main symptom. But the cardinal symptom of Pittaja Grahani, I told you the cardinal symptom of Kafaja Grahani is repeated stools with normal consistency, but no satisfaction. Stools are mixed with mucus and phlegm. That is a cardinal symptom, that is a main symptom of Kaphaja Grahani. Whereas main symptom of Pittaja Grahani is repeated stools that are yellowish in color and mixed with blood. Either it is mixed with blood and there are repeated stools and it is associated with excessive burning sensation. Number one, they have to go to the toilet again and again. The stools are yellow in color or it is mixed with blood and excessive burning sensation is present. Now, whichever is mixed with blood, that is that aspect is of Pittaja Grahani is ulcerative colitis. I will discuss ulcerative colitis in detail in some other topic, but for now I'll discuss basic Pittaja Grahani lakshanas and treatment. What is the treatment of Pittaja Grahani? Treatment of Pittaja Grahani, we have Samanya Aushadhis that I use in everything like Dadimastaka Churnam and Madhifala Rasayanam. Can be used in Pittaja Grahani also, but some patients find Madhifala Rasayana to be extremely amla and increasing the burning sensation in the stomach. For such patients, I cancel Madhifala Rasayana. I won't cancel initially in the first prescription, but if they are not adaptive to Madhifala Rasayana, if they find that Madhifala Rasayana increases, sir, if I take 2 cups of 10 ml of Madhifala Rasayana, immediately my burning sensation starts. Immediately I feel irritated. For such patients, I do not prescribe Madhifala Rasayana. So, main prescription in Pittaja Grahani will be finding a Tikta Kashaya or a Madhura Kashaya. Number 1, Gulichadi Kashayam, that is Tikta Pachana. Vasa Gulichadi Kashayam, that is Tikta Pachana. Gulichadi is useful when the patient is having stools that are mixed with the blood. Vasa Gulichadi Kashayam is very useful in the when the stools are mixed with both the mucus and the blood. And Drakshadi Kashayam, I mix Gulichadi Kashayam plus Drakshadi Kashayam in case the patient has bleeding and the patient also has vertigo. The patient also has vertigo and bleeding, they both together. See, the beauty of Gulichadi Kashayam and Drakshadi Kashayam is you have Gulichadi Kashayam that is Tikta and Ruksha. So, giving long-standing Gulichadi Kashayam, which is Tikta and Ruksha, increases Vata. Ruksha increases Vata. Tikta Rasa increases Vata. So, we need to, it is debilitating to the patient. You continuously give Kashayas like Vasa Gulichadi or Gulichadi Kashayams. It is very Ruksha and debilitating to the patient. To balance that for a longer term, because it takes, this Pittaja Grahani treatment takes longer term, you need to mix it with Madhura Kashaya like Drakshadi Kashayam or Bala Punanavadi Kashayam or Bala Gulichadi Kashayam, etc. You should mix this both. So, Tikta we have to balance with Madhura Rasa. Something debilitating should be balanced with something rejuvenating. And Mahatiktaka Kashayam I use. Mahatiktaka Kashayam and Mahatiktaka Gridam. I either mix Gulichadi Kashayam or Mahatiktam Kashayam and Gulichadi Kashayam and Mahatikta Gridam. Whenever there is excessive bleeding and the bleeding is not stopping with anything, the only thing that to stop the bleeding in ulcerative colitis is Mahatiktakam Kashayam mixed with Gulichadi Kashayam or Mahatiktaka Gridam mixed with Gulichadi Kashayam is an excellent choice of prescription to stop the patient's bleeding. And that I understood while practicing. So at the end of the treatment, you can prescribe Gulichadi Kashayam along with Dadimadi Gridam when the patient has a lot of tiredness, etc. You can prescribe Gulichadi Kashayam and Dadimadi Gridam. Dadimadi Gridam specifically, I prescribe in Mudavada Anulomanam for achieving Mudavada Anulomanam, for relieving of Admana, etc. And in such cases, I prescribe Gulichadi Kashayam along with Dadimadi Gridam, but I don't use Dadimadi Gridam excessively. So, Dadimastaka Churnam along with Takra as a Samanya Aushadhi I give, Vilvadi Gulika as a Samanya Aushadhi I give, only Madhifala Rasayanam I give in initial prescription, but if the patient is not comfortable with the Madhifala Rasayanam, I definitely do not prescribe Madhifala Rasayanam because basically Madhifala Rasayanam is Amla. So Amla increases Pitta. So Vataja Grahani, the symptoms of Vataja Grahani is repeated watery stools and equal bouts of constipation and alternate, associated with the pain in lower abdomen and flanks, and associated with the extreme Dhatukshaya for the patient, weight loss, etc. The Vata is so much so that the patient will have tinnitus, ringing sound in the ears, and because the patient is having this Vataja Grahani. So it is very difficult for the patient of Vataja Grahani, their mental status will be horrible. See, a aged patient with a Vataja Grahani cannot go anywhere in bus, cannot go anywhere in car. They have to only choose train, because they will get episode of dysentery once in every half an hour or 2 hours. So they have to choose a train for wherever they are going, because they cannot get in the car, because once they get in the car they have to stop once in a while. So train is better for them. And everywhere they go, they have to, if they had to go to a temple, or they had to go to a special place, they have to wear their adult diapers, and they suffer from so much mental agony, so much. Just imagine if anyone has the same condition, how their mental status would be. So such will be the condition of Vataja Grahani when they have repeated bouts of dysentery continuously every 2 hours, and then constipation for 2 days. It will be very, very much horrible. So we as a doctor should have extreme empathy and sympathy for those patients. So coming to how we treat the Vataja Grahani, before treating Vataja Grahani, we need to identify whether the particular Vataja Grahani, the chronic Grahani patient comes, we see all the symptoms and we identify it as Vataja Grahani. We have to find out whether the patient, the Vataja Grahani is associated with the ama or it is not associated with the ama or ajirna. How would you find the patient of Vataja Grahani? The same symptoms, the same Vataja Grahani symptoms, when it is associated with the ama, patient will have lakshanas of ama. Like what are ama lakshanas? As mentioned in Ashtanga Hridaya, Shrotarodha Balabramsha, Gaurava Anila Mudataha, Aruchi Apakti Nishtiva, Klama, everything will be there. The tongue will be coated. They will feel severely heavy after the intake of food. They don't have proper digestion. Their stomach will be bloated regularly. And all those other symptoms of ama will be present. If the patient of Vataja Grahani has ama, the treatment is different, and they are nirama, the treatment is different. If they have ama, the first thing is we need to correct that ama. Go back to Kafaja Grahani Chikitsa, that is the proper treating of Kafaja or Amaja Grahani. Such protocol has to be followed before treating the Vata. First ama has to be cleared. Like Kaidaryadi Kashayam and Vilvadi Guliga, Madhifala Rasayanam, Indugantha Kashayam, Pachanamrita Kashayam, etc. All those Jirna Dravyas has to be given, and the patient should be, because without having proper digestion, even medicines won't digest properly. No matter if you directly give Dadimadi Grita to the patient with ama, definitely Grita will increase again the symptom of Grahani, and Grita will go in dysentery only. So it is very important that we should identify whether the patient has ama lakshanas or not, and then proceed with the treatment. If they have ama lakshanas, treat the same as Kafaja Grahani. Give them Pachana and Deepana Aushadhis and make their digestion better, and then come back to treating the Vata. So and if it is a Nirama Grahani, ama is not greatly associated for the patient, how do we treat Nirama Grahani? See, Grahani, treating Vata in every disease is like playing kabaddi. You go one side, the disease will go other side. You go other side, the disease will go this side. So, for example, if you are treating a patient with a severe Vataja Grahani, say if the person has lot of bleeding, you give Mahatikta Girda, then the patient will have lot of Ajirna and ama. If the patient has lot of Ajirna and ama, you give Kaidaryadi Kashayam or Vilvadi Guliga, Shaddaranam, etc. The patient have more bleeding. So while treating this condition, we have to be extremely sensitive and situation biased rather than choosing a single drug per se for all the conditions. We have to be extremely sensible about the climate, about the kind of food they are using, and the kind of climate, and the kind of Rutucharya that they are in, and the kind of Desha that they are in, and the seasonal changes happen within the intestine, whether they are bleeding, whether they have ama, whether they have nirama. All these conditions should be particularly taken care of. See, treating a simple Kafaja Grahani or Pittaja Grahani anyone can do. Treating a complex Vataja Grahani is what makes you a great Ayurvedic doctor. Treating Sannipataja Jwara, that days, in those old days, was the benchmark of completing the internship and the course. And just like that, today, if you are an excellent doctor, you should be able to successfully treat or at least maintain Vataja Grahani for what it is. So you have to be very sensible about the varying conditions that happen from time to time, and you have to be very encouraging to the patient. You need to be very patient with the patient, listen to their symptoms, reassure them 1,000 times, because it's a horrible condition for anyone to have. And you also have to keep in part that the patient is extremely stressful, and it will not hurt a little when you listen to the symptoms more and reassure them a little. If the patient of Grahani has Sama Lakshanas, we can also choose Kaidaredi Kashayam, Pachanamrita Kashayam, etc. And always remember in mind, Bhaskara Lavana Churnam will be of great help. Why Bhaskara Lavana Churnam? Because it contains Lavana. Lavana is the opposite rasa of Vata. Lavana contains electrolytes, Lavana contains sodium, and it is exact opposite and gives bala to the patient. So, and it is Ruchyam, Pachanam, etc. You can choose Bhaskara and Lavana Churnam. And Takrarishtam is an excellent drug of choice in Vataja Grahani. It helps a lot. And there is also a formulation in Siddha called Tair Chundi Churnam, which is a mixture of curd and buttermilk. They are dried curd and buttermilk and made in churna form. It is an excellent choice of Dravya in Vataja Grahani because it also contains all the probiotic stuff, and the curd and takra is very good for Grahani. We can use that yoga also. It's very, very helpful. So, per se, if the patient has Nirama Grahani, then what you should do? The patient has Nirama Grahani, my first drug of choice will always be Jeeraka Bilvadi Lekhya. If they have good Ajirna, Jeeraka Bilvadi Lekhya by Imcop's company. By Imcop's company is an excellent drug of choice. It's a very beautiful dravya. What Jeeraka Bilvadi does? Jeeraka Bilvadi makes sure the patient does not have hama very often. It helps in digestion. It helps in gastric absorption. It helps in gastric retention. It helps in delaying the bouts of dysentery. If the patient is having every 2-hour dysentery, having Jeeraka Bilvadi will make the time extend to 4 hours or 5 hours per se. And it is an excellent drug of choice, and I only will use Imcop's company or any other company which gives quality. Because if not properly done, this yoga is not going to help the patient. So Jeeraka Bilvadi Lekyam is excellent drug of choice. And you can use Balya Dravyas which contains calcium like Pravala Basmam, etc. Because there will be regular dysentery, there will be loss of electrolytes, loss of potassium, loss of calcium, etc. And that micronutrients has to be substituted to the patient somewhere. That is why in all Grahani we make sure it has a point to use Madhifala Rasayana or Matalunga Rasayana. It contains Amla Dravya, which is Vadahara, and it contains electrolytes. And it's an all package in one. Okay, so we have to use Balya Dravyas. When chronic Vataja Grahani patient, when you see that they are having Balakshina and they are having anemia and they are having Pandu Lakshanas, etc., it is better to choose Dadimadighritam. If you are having if you think Ajirna will be present, you can also mix Gaidaryadi Kashayam plus Dadimadigrita or Guluchadi Kashayam plus Dadimadigrita according to the condition of the patient. Giving Guluchadi Kashaya plus Grita, either Dadimadigrita, ensures that the Agni Deepana is done, the Pitta is not kept in check regularly. So Guluchadi Kashaya along with Dadimadigrita instead of directly giving Dadimadigrita is better. So if the patient is having repeated Pitta involvement, like repeated bouts of burning sensation and bleeding along with it, then Guluchadi Kashayam plus Mahatikta Gridam will be excellent choice. There don't use Dadima. Dadima is a little Ushna, Dadima Grita. There you can use Mahatikta Grita, which will be excellent in stopping bleeding. Again, Mahatikta Grita per se will cause ama. You can use it or mix it with Guluchadi Kashaya. And regular Dravyas, whichever I give for Grahani, regular Dravyas like Vilvadi, Guliga and Madhifala Rasayana will be permanent. I'll give to all Grahani patients depending upon the condition. So, if Pitta is present, you choose Gulichadi Kashayam plus Mahatikta Gridam. If Pandu is present, you choose Dadimadi Gridam plus Gulichadi Kashaya or Kaidaryadi Kashaya, etc. And Vilvadi, Guliga and Madhifala Rasayana is common for all patients. So, in first stage, you choose Gulichadi, which is Tikta Rasa. It will give Ruksha to the patient. In the next stage, you can shift to Bala Gulichadi, which is having little Madhura Rasa, and it will be Vatahara. Because Tikta Rasa per se for long term increases Vata. So it is better you shift after some time you shift to Bala Guluchadi Kashayam plus Mahatikta Gridam or Guluchadi Kashayam plus Dadimadi Gridam, Vilvadi Guliga, Madhifala Rasayanam, Jeeraka Bilvadi Lekyam, depending on the condition of the patient. If at all I give Jeeraka Bilvadi Lekyam, I give a half spoon initially before food because Agni is very, very weaker in Vataja Grahani patient, and I gradually increase it to 1 spoon or 2 spoons. That is how it should be done. And even when in the Nirama Grahani patient, remember, they can go back to Ama Lakshanas at any particular point of time. That is why we need to be very sensible and very careful about how do you treat these patients, and we have to be condition specific and the bias towards a particular season based or complaint based rather than choosing a one drug for the entire year. And Vajagrahani patients, you should always advise them they have to take the treatment of minimum 1 to 2 years to get to provide a proper maintenance and results.